Hello, this is Mayor Chris Bolwage and Our City. The Department of Health and Human Services, in partnership with Doc Spot Walk-In Urgent Care, presents Elizabeth Gets Screened COVID-19 testing. It is free at the Exlaven Center, 513 Richmond Street. The testing is every Tuesday and Thursday, 3 p.m. to 7 p.m., and Saturday, 10 a.m. to 3 p.m. Proof of health and insurance or a photo ID are required. Now, if you don't have insurance, there is not a need for you to walk away. You will be taken care of, and there is no copay or bill. But if you have insurance, please present the card. If you want to avoid any lines, you can pre-register, and you'll see the registration site pop up on the screen. Or you can go to any of our social media pages or scan the QR code on the Elizabeth Gets Screened flyer. So please, if you feel symptoms or you need to get tested, we're providing free testing. If you want to speak with anyone who can assist you about general questions about the vaccine or any help in identifying sites, please call the state toll-free number from 8 a.m. to 8 p.m., and that is 855-568-0545. You can register online for vaccines at the County of Union website. Please visit www.covidvaccine.nj.gov. That's for the state, or you can visit the county website at ucnjvaccine.org. Please continue to follow all of the social distance rules. Please wear a mask or a face covering whenever you're out in public or you have visitors in your house. If you have any questions, you can reach us on our social media accounts or call 908-820-4124. Now, since COVID hit on March 16th of last year and the city of Elizabeth, as well as the rest of the nation, shut down, the city of Elizabeth has worked really closely with our Health and Human Services Department. And the Director of Health and Human Services Department has been working nonstop on COVID. Matter of fact, the other day I sent her an email, had nothing to do with COVID, and she was like, wow, I get to work on something else besides COVID. But she is doing a great job in shepherding the entire department in helping our citizens in this city get through COVID-19. Director Krishna, welcome.
Well, thank you. Thank you. Happy to be here.
So first of all, Director, we're going to talk an awful lot about COVID, but you've been here now for what, 7 years, 8 years? How long are you here?
Oh, yeah. I think it's about 8 years now.
Yeah. I really enjoy directors who have no idea how long they're here.
Yeah, so I think it's 8 years now.
8 years, right? Yeah.
So maybe a little longer. I don't even know, Mayor. When did I come? I came in 2012.
There you go. So you're in your ninth year.
Ninth year. Yeah.
So
you grew up in Elizabeth, right? Went to school. You have a George. Tell us a little bit about yourself.
Yeah, so I grew up on Broadway in the First Ward. Always proud of where I came from. Went to School 1, which is now School 1 and 9, right? So things change. Definitely a part of the Gifted and Talented program through the Elizabeth school system. Graduated, went to Hampton University in Virginia, where I got a degree in psychology, majored in psychology, a minor in English, and then went on to go to law school in Rhode Island, to Roger Williams School of Law.
Good for you. And now you're here.
Now I'm here. So went into the nonprofit sector first, worked for the state of Rhode Island for a while, and now, back in government and really enjoying everything that we're doing and all of the challenges that present themselves, although sometimes we might get a little frustrated with some
well, we do. That does happen, right?
That does happen. But, feel like this is a great seat for me to sit in, to just be available to the community. And, COVID and the pandemic is what's the pressing issue right now, but there's always something, right? So there's always something that we have to respond to the community and be there for them. And as a Director of Health and Human Services, I mean, it's just so diverse, the requests that come from the city and what we're able to do for people.
So, Director, you've grown a lot in the last year, and sometimes by the seat of our pants, we've learned and we've gotten lessons. So on March 16th of last year, when the city shut down and the state and everything else, we were told to stay home as we all learned about this virus. Tell us about how you got your staff going during the testing site, and then we'll move into vaccines.
Yes, I think one of the things that I'll say that's the great, under the leadership of yourself and Mark Lickle, the health officer, and the great team that we have of directors. I mean, I think a lot of the emergency planning we had in place already. We had talked about when something happens, whatever that is, not knowing what that emergency would be, how do we all respond? What's that going to look like? What's our pod plan? Our connection with the county, our strong relationships with outside organizations. So I think we had planned for that. So I think that really helped in being prepared when the pandemic began, was that we had kind of this manual we could go to so that we could and the conversations that we had, so we would know who to call in, what the emergency plan was and what it was going to look like. But I mean, our staff really quickly met to talk about, well, after we realized that the pandemic was going to last more than 2 weeks, right? Because I think initially all of us were kind of like, this is short term. We're going to be out of work for a couple of weeks and they're going to figure this out and then we're all going to be back to normal. I don't think anyone anticipated that a year later that we would still be dealing with this. But our, staff came together. We said, okay, if we're going to start doing testing, where are we going to do that? What's that going to look like? Who's the staff that we're going to train? What are going to be the resources? We worked very closely with the County of Union to get our residents to training to testing at King University. Our transportation staff went right into helping to deliver meals to families, helping to set up our Office on Aging, setting up meal deliveries for senior citizens. Again, working with the county on large scale food distribution, responding to our seniors, calling them every day to find out that, what are your needs, because you can't come to our congregational programs, so we're not able to make sure that you're okay. But do you need food delivered to you? Do you have any medical issues that are going unaddressed? Is there anything we can do to support you? So our staff was really wonderful around that. Similarly, our Office on Youth staff was calling our kids and setting up Zoom conversations with them to check in to see how they were doing, being at home. Some of their parents still had to go to work. So just making sure and being that support system for them, getting those families meals, access to testing.
Yeah, Director, talk about the meals program. We worked with Freeholder, now County Commissioner Sergio Granados, who's on your staff as well. What was it, about 300,000 meals at all the locations?
We delivered either walk-ups for people to pick them up or deliveries to people who could not leave their home, over 300,000 meals, 6 days a week.
And that's not counting how we worked with the schools in making sure all the kids got lunches.
Exactly. So we made sure that children received their, lunch and breakfast program meals. We supported that. We advertised it, got it out to all of our kids in our youth programs and to the community. And so I think, when it came to making sure that our residents had access to food, I think we did a great job as a city and a county just working together to make sure that that happened.
So, Director, one of the things you did back in March and April of last year was we were getting masks out to all of the citizens of Elizabeth, and we were making them available in your office. We were delivering them to seniors. But you also put staff on bicycles and went to the people that were homeless and living on the streets and made sure they had a mask. Tell us about that program.
Yeah, so absolutely. So we had all of our recreation centers open where the recreation staff was distributing masks to residents who walked in who just said that they needed them. And so we made sure that for a period of time that was happening. We definitely worked with our elected officials and our resident program managers at senior housing to make sure that we made masks available to all of the seniors. We worked with our homeless program at the YMCA, Salvation Army, to make sure that they had access to masks and hand sanitizer and gloves. We had employees who got on their bikes and went out into some of the more difficult areas to where we have populations who are a little more challenging to reach. And they gave them hot meals. They distributed those on a daily basis. They gave them masks, hand sanitizer, gloves, just trying to make sure that we reached all areas of our population.
So we did all that during March and April and May. And then as the vaccines started to get ramped up, you and I had numerous discussions back in October and November about how can we prepare to be a distribution site. And the first thing was we need to buy freezers. And so we got actively involved in that issue in working with Eileen. So tell us about how you and your staff coordinated all the syringes and the gloves and all of the digital loggers, things I never even heard of that we had to do back in November and December.
Yes, yes. Yeah, that's part of the learning on the job, right? So, yeah, there was a whole list of supplies, and it was kind of difficult to prepare because you didn't really know what you were going to need, right? Because the vaccine was still, kind of underway. There was the state or the federal government wasn't, saying, here's a list of what you're going to need, but we knew that we needed to be prepared because when the vaccine became available, everyone was going to be trying to order the supplies. So, again, as a team, we identified what the list of items would need, we would need. The refrigerators and the data loggers were a big part of that, in being prepared and not knowing exactly what temperature we were going to have to store everything at because we didn't know which vaccine we were going to get, but just making sure we would be prepared either way or for both. So we were able to get all the supplies in. Again, that's part of the pod planning that happens that, the health departments are responsible to do in coordination with the county. So we were able to get all those supplies in and stored. And then when the vaccine became available, we were ready. And because we have an experienced vaccine clinic staff under the leadership of Eileen Kelly, they were able to go right into action as soon as those vaccines became available. Part of the challenge, as was scheduling the numerous amount of people who wanted to come in for the vaccine and working with the state on their scheduling system. But once we kind of worked through the kinks of that, the staff is excellent at providing, the care that they do with the distribution of the vaccine to the public.
And you've worked with Olga Ugemeyer over at the Board of Ed, and she's given us nurses to help expand our ability to give out vaccines. And just last week, we gave out over 1,300 first doses and something like 500 as second doses, which is a phenomenal number for. Could we give out more if we had more product?
Oh, absolutely. Absolutely. So the Board of Education nurses, the Board of Education just in general has been a great partner, right? And so I think one of the things that we recognize is that this is not something that the city of Elizabeth is doing alone. It's definitely in partnership with Union County and the Board of Education and, so many others, businesses who stepped up to donate food. And when we were giving out, distribution to the community, those people stepped up and said, hey, I want to help give to the community as well, right? So I think this was a great opportunity as much as COVID and the pandemic has been, so emotionally draining for us and the losses that we've had. And, there was also a lot of shining lights or bright lights that came out of this where people have come together and really worked together for the good of humanity. And just seeing that has been amazing. Being in the seat to help be able to negotiate some of that and make the connection and connect the dots has been great. So we could not have done this without the Board of Education nurses. They were.
So when you talk about people stepping up, I remember visiting the vaccination site, and the nurses and the doctor said to me, I am thrilled that the city of Elizabeth can be a distribution site of the vaccines.
Yes.
Which is a testament to your efforts and your hard work that we've gotten that far. And now we're doing almost 2,000 between the first and second shots a week.
Absolutely. While we still maintain testing sites, right? So, we're doing the vaccine sites and we're still maintaining testing sites because people still need to get tested. They still need to be aware of when they're positive. They still, people, especially during like Super Bowl and holidays, and, people are putting themselves in situations where they're at risk of still spreading COVID. And as we try to get back to some semblance of normal, there's going to be more and more of those situations. And so we just need people to continue to be very vigilant, to make sure that they're getting tested regularly. We're going to continue to offer those testing sites for as long as we possibly, can. We're trying to move them around in neighborhoods, but we're also encouraging people to please get vaccinated, to please get vaccinated. It helps us to be able to really cut down on the spread of this disease.
Now, there's two different vaccines that have been approved as of this conversation. We're waiting on more, AstraZeneca, Novavax, and Johnson & Johnson may in the future, but right now there's two. Tell us about Pfizer and Moderna, because Pfizer is also being given out in this community as well.
Elizabeth and the County of Union are both giving the Moderna vaccine, and it's a 2-dose series. So you come in for your first dose, and then with Moderna, 28 days later, you're scheduled for your second dose. Trinitas Hospital, who's also vaccinating in our community, is giving the Pfizer vaccine. The Pfizer vaccine is also 2 doses, but there's a shorter time period between the first dose and the second dose. It's 21 days, and you'd be scheduled for the second dose and then come in for that.
And Director, we worked with CVS in order to get all of the senior buildings vaccinated, as well as the nursing homes have all been vaccinated. And your office played a role in an advisory capacity there. Tell us about that.
So we worked very closely with our housing authority to make sure that the seniors who are living in senior residences were able to get access to the vaccine. So the CVS and Walgreens actually set up right in the buildings and came in to provide first doses and second doses for our seniors in their buildings where they live.
And we're currently working with FEMA, targeting the African American and Hispanic American communities for a 2-week session at the Dunn Sports Center.
Yes. Yes. So we've been in partnership with our local Black and Hispanic churches in the community, as well as elected leaders and community leaders of color, and just talking to them about how important it is that Black and Brown communities have access and are encouraged to get the vaccine. So FEMA will be here from February 22nd to, I believe it's March 5th. Providing 3,000 doses to our residents. They'll provide the first dose, and then they'll be back 28 days later to provide the second dose. It is the Moderna vaccine. And so we are working diligently to get information out to the community, to residents who qualify to come out and get the vaccine on those dates.
Director, one of the things in the African American community, the media constantly hypes that they don't take it, the percentages are low. And it's a combination of not having access to the internet in some communities, afraid, past information from the government regarding vaccines. But we're seeing a little different in our community, especially with the seniors in they seem to want it.
A lot of their friends, families, peers who have unfortunately fallen victim to COVID. So, and I think also for seniors, although for Black seniors, they've lived through the Tuskegee experiment, they've also lived through other first vaccines, right? So for them, I think their knowledge is a little different. They have that, the history of the bad experience of the Tuskegee experiment, but they have other things like the flu vaccine, the pneumonia vaccine, the shingles vaccine that have all not been bad experiences that they're able to point to. The younger generation is a little bit more of a challenge, right? Because I think with the 40, 50, 30, there are people who kind of don't get any of the vaccines. And so it's a little more difficult than to say to them that, you should get this one. But we're working on it. We definitely have an outreach coordinator or a vulnerable populations outreach coordinator who's doing workshops. We're putting together videos. We're doing panel discussions. We're making ourselves available to talk to anyone and everyone who has a population who should be, getting the vaccine.
So right now, the way to get registered is through the uccvaccine.org, correct? That's the county website. And tell us, on March 1st, up until now, we've been relying on the state to send us appointments. And they've been coming from all over. But come March 1st, it's going to be strictly county residents and priorities in Elizabeth.
Absolutely.
And so who qualifies right now? There's a lot of people, 1A, 1B. Most of the emergency service people, if they wanted it, they've had access by now.
Right. Yes. So fire and police, EMTs, they all qualify. EMS, the healthcare workers, they all qualify. And for the most part, if they want it, then they've had access. They can still come in to get it because they are still a priority. And then we have all of our seniors over the age of 65 who also qualify. And for any of the seniors who don't have access to the computer, they can also call our office and they can get assistance with scheduling through one of our Office on Aging employees who will go on and help to register them. So they should not, use that as a reason why they could not get access. We'll help with transportation for anyone living in Elizabeth. If they need transportation to go get the vaccine, that can also be arranged by calling our office. The other group who qualifies would be anyone with underlying conditions or pre-existing conditions. So obesity, smoker, diabetes, high blood pressure, cancer, and a whole host of other things that make you eligible. So if you have any pre-existing condition, you should go on and register, and no one's going to ask you the personal details of your medical life. Really, it's a yes or no question. Do you have a pre-existing condition? And you just have to say yes. And so, we're not going to get into your personal medical history.
So, Director, tell us about the some of the misconceptions on vaccines real quick, especially this one. Can you get the virus if you get the vaccine?
So the vaccine after 2 doses is 95% effective, right? So there is that 5% chance that you could get the vaccine after being totally vaccinated. There is a waiting period so when you get your first vaccine, 2 weeks later, they say you're at 50% effectiveness. So you're not totally protected after your first dose. After your second dose, obviously the protection increases, right? But they're still saying that you have to wait 2 weeks after your second dose before you're at 95%. So there are people who unfortunately have gotten the vaccine in between first and second dose. It's just about exposure. And, we don't know when or where that happens, so that we've been around somebody who's positive, but there are people who have done that. There is a recommendation that if you are COVID positive, that you wait a period of time before your first dose. But if it happens between doses, you have a choice whether you want to wait or move forward with getting your vaccine on the scheduled day.
Director, I want to thank you for taking the time out of your schedule today. I know you're extremely busy in working with the citizens of our city in order to get vaccinated and testing, and appreciate all of your work. Thank you.
Thank you. Thank you, Mayor, for your leadership.
Thank you to Director Krishna Garlick and all the work of the Health Department. And keep in mind that whether you get a vaccine or you do not get a vaccine, the most important thing is to wear a face covering or a double mask when you are out in public, and wash your hands as frequently as possible. I am Mayor Chris Bolwage, and we'll see you next week on another edition of Our City.